with that, I'd like to introduce Jeff Crowley as our first presenter. Jeff is the Director of the Office of National AIDS Policy and a Senior Advisor on Disability Policy at the White House. Jeff is the President's lead advisor on HIV/AIDS policy and is responsible for coordinating disability and healthcare policy issues of the Domestic Policy Council. Prior to serving in this position, Mr. Crowley was a senior research scholar at Georgetown University's Health Policy Institute and a senior scholar at the university's O'Neill Institute for National and Global Health Law. Please welcome Jeff Crowley.
Good morning. It's a pleasure to join you this morning. So as Brian said, we did release the National HIV/AIDS Strategy about 3 weeks ago. This is something the President made a commitment to during the campaign, and it's something that as soon as he got in office, he tasked me and my office with working on this. I will say, so we released this at the White House. We had an event with Secretary Sebelius, Melody Barnes, who's actually my boss. She's the Director of the Domestic Policy Council and the President's Domestic Policy Advisor. Dr. Howard Koch, who's the Assistant Secretary for Health at HHS and has a significant role in implementing the strategy. So we released this at an event at the White House, had a press conference. But then later that day, the President hosted a reception for the HIV community in the East Room of the White House. And, on one hand, I sound silly by saying a party's so important, but if you step back and think about everything that's going on in the world right now, all the challenges our country faces, but all the pressures that this President faces, he didn't have to do this, and I think that it's a tangible sign that this President really cares about HIV and is committed to responding. And I think the reception, and I often sort of tell people, it's meaningful when we have this strategy, not that we put it out, but it has the seal of the President on it. So that says that he's personally taking ownership of this. And I think that's really significant because, as we know, leadership matters. And I think he's really committed to responding forcefully to our domestic epidemic, even at a time when our country faces major challenges. So I think the rationale for the strategy was, there's many rationales, but I'd say one thing is that he recognizes something I think many of us recognize, that maybe we've sort of lost sight of the domestic epidemic in this country. And he's always said, taking nothing away from the PEPFAR program, he's always asked us to honor President Bush's leadership in PEPFAR, and he's committed to continuing that. And he believes that we're doing great things to save the lives of millions of people around the world. So taking nothing away from that, by focusing so much in recent years on the global epidemic, I think people in this country have gotten the sense that things aren't so bad here. We still have a very serious domestic epidemic. So when he made this commitment, he identified 3 key goals he wanted us to focus on: reducing HIV incidence, getting all people living with HIV into care. When we think of that broadly, what are the steps we need to take to improve health outcomes? And the third goal is reducing HIV-related health disparities. Now, the community, I think, originally asked us to hold at least 2 public meetings, and we tried to show that we were going to do the maximum and not the minimum. We held 14 community discussions all across the country, including the territories. We had an online call to action. So last fall, we had, over a couple months, we took suggestions on our website, got about 1,000 suggestions that way. Various community groups held their own meetings when we could. My staff participated in some of those. Other people did things. We produced a summary report last April, which is where it was a reflection not of what we thought, but what we reported back, the things we heard over and over. So we had extensive process, starting in really December of last year, but going through last month, we had a very robust process with our key leadership at the federal level. It's our Federal HIV Interagency Working Group. Dr. Parham Hobson was a key part of that. But we had really tried to tap into the broad expertise we have in the federal government. We need to reflect on that. It's not just that we have these people in these jobs, people that have invested their careers in fighting HIV at HHS and elsewhere really guide us. And their role was to really help me and my office sift through the thousands of recommendations. So if you can imagine that we held 14 meetings and we had literally thousands of people give us their ideas. How do you make sense of that? It was a challenge. And so this interagency group helped us do that. They gave us their own recommendations, and we think that was important. So the vision for the National HIV/AIDS strategy is that the United States will become a place where new HIV infections are rare. And when they do occur, every person, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic circumstance will have unfettered access to life-extending quality care free of stigma and discrimination. And that's really where we think we need to get to as a country, and that's what we hope the strategy will help us do. So when we released the strategy, we actually released three things at once. We released the strategy itself, we released a federal implementation plan, and this identifies very specific goals and targets, actions that we plan to take this year in in calendar year 2010 and calendar year 2011. And we plan to update this going forward. But it's really our effort to say, this is not business as usual, and these are very specific things we're going to try to do. Now, I will tell you that, working with the federal agencies, that I wouldn't let them say, okay, these are all the things we're comfortable we can do and we're sure we're going to do. So I know there are things in here we won't get all of them done. But we said, this is what we're working for. We're going to really push ourselves, and I think it's an honest effort to show some urgency on our part. The third thing, though, is that the President released a presidential memorandum. So this is a memorandum that goes to heads of all the executive agencies, and it directed from the President that certain things take place. So for me, he directed that, one, I guess I would continue the role I've had as setting the administration's HIV policy, but he's also asked me to report to him annually on the progress we're making in meeting the goals of the strategy. He said that this demands a government-wide response, but he identified 5 lead agencies: Health and Human Services, HUD, Labor, Justice, VA, I guess 6, and the Social Security Administration as lead agencies in responding. They have very specific tasks. He's directed them that within 150 days, they develop and submit to my office and the Office of Management and Budget an operational plan. So how are you going to actually do all these things? And how are you going to move forward on the implementation and take the other steps that we need? He also said they need to identify a single person that's responsible for coordinating within their agencies. So if you think about HHS, we have HRSA, we have CDC, we have CMS, FDA, lots of agencies. We're going to have one person who's responsible for coordinating and improving that effort. He also said, there needs to be ongoing activities that take place. He gave specific direction to the Secretary of Health and Human Services, and she's delegated Dr. Howard Coe, who's the Secretary for Health, to have specific responsibility for improving coordination across the federal government, within HHS, but across the government. And that's something that we think is really important. The memorandum also, though, speaks about responsibilities for other entities. So the Department of Defense has been asked to come up with a plan, again within 150 days, for how they're going to implement the strategy within the context of the healthcare programs that they operate. The Equal Employment Opportunity Commission has been asked to develop a report for the steps that we can take or should take to address HIV-related discrimination in the context of employment. But also, what are the steps we can take to increase employment opportunities for people with HIV? And then lastly, the Department of State, and I think Secretary Clinton's delegated this to Ambassador Gooseby, has been asked to give us a report on what are the lessons we've learned from the PEPFAR program that we can apply to our domestic response. So again, these things together, the strategy, the plan, and the presidential memorandum, are our effort to say we're serious and we hope that we can really move the ball forward. But I also have to say that, I get nervous when I talk about this because we are doing a lot at the federal level, but this is not a federal plan. It's a national plan. And I can't control lots of things that lots of other people do, but we'll only be successful as a country if lots of people do their part as well. I can suggest some things, but I hope that all of you will really read the strategy, but I also hope you'll take it and run with it. Because you know things in your own work, you have your own ideas, and think, this is how I can contribute, and I really encourage that. Please don't wait for me to come to you and ask you to do it. I'm asking you now. But also, I think a lot of times people think, well, my job is to tell me or the federal government what they need to do. Yes, you can do that. But also, we need lots of people to really re-engage.